Okay, I'm going to demonstrate how to do aseptic transfer from one broth tube to another, and then I'm also going to demonstrate how to do aseptic transfer to our TSA plate as well. I already have my flame going, and I'm going to start off by sterilizing my loop. Remember, you want the entire loop to turn orange. And I'm going to let that cool for about 20 seconds or so. Now notice that I'm holding the loop like a pencil, and I have my nice little fancy finger over here. That's important because that actually has a function. So here is my bacterial culture, and I'm going to actually take from this culture and I'm going to inoculate into a nice fresh tube of media. So this is a mixed culture of bacteria. I'm going to use my fancy finger to grab onto the cap, and then I'm going to unscrew with my non-dominant hand. Now, just to make sure that we don't have any bacteria maybe floating on the lip of this tube, we're going to go ahead and pass it through the flame a few times. Then I'm going to carefully dip my loop into my culture, grabbing a loop full of bacteria, and then I'm going to go ahead and flame the lip of the tube again. I'm going to replace the cap. I'm not going to worry about tightening it. I can do that at the end. I'm going to grab my nice fresh tube of broth, again using my fancy finger to grab the lid. I'm going to unscrew, flame the lip of the tube, then dip down to inoculate, lift back up, flame the lip, replace the lid, put that down, and now I can re-sterilize my loop. Now notice that I didn't have more than one tube in my hand at a time. That's one of the biggest mistakes students will make, is they'll try to grab all the tubes at one time, and then you can end up spilling bacteria and spilling your culture. Now I'm going to go ahead and tighten up the caps a little bit, but I don't want them too tight because you want the bacteria to be able to breathe, so you should be able to kind of wiggle that around, but it shouldn't come off. And then I need to label my tube with some tape. I'm going to skip that step, but you guys make sure that you put your tape label on your tube and also include your initials and then today's date. Alright, our next procedure is we're going to actually inoculate the TSA plate using the 4-quadrant streak method. Now I say the 4-quadrant, but we're actually going to do 3/3. And it's a little bit easier, and you usually end up getting isolation. So the whole point of this is to spread that bacteria across the plate so much that it becomes physically diluted, and you just end up with one teeny tiny little spot or bacterial cell on that plate, and then that will grow, divide to form a visible colony. So again, I'm going to flame my loop, make sure the entire thing turns orange, indicating that it's sterile. Let it cool. And my plate is actually already labeled with TSA on there, so I'm actually going to use that as a marker of where I'm actually streaking. So I'm going to start right there at the top where that TSA sticker is. Okay, my loop should be cool. I'm going to again grab the tube, use my nice fancy finger to wrap around that cap, unscrew with the other hand, flame the lip, dip, grab some bacteria, flame the lip again, and then put my tube down. Now I'm done with this for this procedure, so I'm going to kind of push that out of the way. I'm going to lift my plate up. Notice that it is auger side up, so I can just easily lift it, flip it over, and now I'm going to start streaking. Ooh, it's a soft auger. Streaking where that label actually is. And I'm going to streak to almost halfway down. Now I want to keep my plate closed as much as possible, so I'm going to go ahead and lay it down again. And then I'm going to flame my loop because I want to get all the bacteria off of that loop. Now we're going to take our loop once it's cooled down a little bit, and I'm going to go into the area where I just streaked, and I'm going to grab some of that bacteria, and I'm going to spread it out on another area of the plate. So I'm going to grab some bacteria over here and just gently spread it. Now I don't want to go back into that area now that I've went one time, so I'm just going to spread it back and forth until I go about halfway down. Put my plate down, flame my loop again to clean it off. Okay, and going to grab my plate, turn it 90 degrees. I can kind of see, if you can actually kind of tilt it back and forth, and you can actually see where your streak marks are. And now I'm going to grab from where I just streaked, pull that bacteria over, and now I'm going to start spreading it out. And again, this agar is really soft. Spread it all the way down, but not going to go about halfway down, not going to go back into that first area where I was streaked. So I'm going to stop before I get there, and I can actually see it. I can see the streaks in the agar where I have actually plated it. And I'm going to flip that back, down, flame my loop, and I'm done. So in essence, I actually, let me see if I can grab a marker really quick and show you what I did on my plate. So that plate, I basically started off here and I smeared my bacteria across the plate, and then I flamed my loop. I came back, I grabbed some bacteria, and then I just zigzagged about halfway down. Then I flamed my loop, flame my loop again, and then I grabbed some bacteria and I zigzagged again down until I almost touched that first area where I was streaking, but I stopped before I touched it. And at the very end, you're going to go ahead and flame your loop again. When you're finished with your gas, of course, be sure to turn it off.